Namaste and welcome. I'm Dr. Rajeev, Iyer, a pediatric anesthesia doctor. In this video, I will tell you if you can have COVID vaccination along with general anesthesia, and the fun begins now. Most of us, including me, are vaccinated for COVID. Are you still not vaccinated? You should go get it done. Now, there are two things that can happen. The first thing is you have a vaccine and you need general anesthesia for some reason. The second thing is you have had general anesthesia for some reason and now you decide it's time for you to have a COVID vaccine or a booster dose. There is also a third category. Now, you have had COVID vaccine, but you never know. You end up having general anesthesia or an operation or something else. This could happen to anyone at any time. And here, I'm going to break all these three down based on my experience and also based on what I have read. Now, question to you. Do you believe in COVID vaccination? Comment yes or no below in the comment section. Now, let's talk about the first thing, which is you had COVID vaccination and now you're requiring general anesthesia. As you probably know, COVID vaccine is a foreign body, which means something else is injected in your body. This can mount an immune response. Now, this immune response can cause fever, chills, and other symptoms. If you have general anesthesia and now you're having symptoms, it would be really hard to differentiate if those symptoms are because of anesthesia or because of the vaccine. So if you had a COVID vaccine, it is better to wait at least a few days or as long as possible before you have general anesthesia. Of course, assuming you can wait. This will make sure if you have any symptoms with COVID vaccine, they're all gone and now you're having anesthesia with no problems. Now comes the second category. You have general anesthesia and now you decide you want to get COVID vaccine. This is the easy part. COVID vaccination is not something that is done on an emergency basis. So once you have general anesthesia, this could be either for an operation or for a medical procedure. As long as you start feeling better after that and you recover from the surgery, you can go have your COVID vaccine shot. This could be your first shot. It better not be first shot, but if you have never had it, this could be your first shot. This could be your second shot, or this could be your booster shot. Many people are also having the second booster and eventually the third booster and so on and so forth. Coming to the third category, what if you have had COVID vaccine and now you need anesthesia on an emergency basis? This could be an emergency operation or something emergency. Life is unpredictable. Things can happen. In this case, it is completely fine to have general anesthesia even immediately after COVID vaccination. Now that you know what happens when there is COVID vaccination along with anesthesia, you might be wondering, how is anesthesia given? Do check this video out to find out how anesthesia is given, what are the options, and how things are actually done in an operation theater. If you're interested in videos related to anesthesia or operation in children, make sure you subscribe to the channel so you get videos related to this. Take care, stay safe, and I'll talk to you soon.